Every single night, more than 37 million Americans go to bed with blood sugar levels that quietly climb while they sleep. Not slightly elevated, but dangerously high, sometimes spiking by 40 or 50 points between midnight and dawn. And the cruelest part of this story is that most of them have absolutely no idea it is happening. They wake up exhausted, foggy, thirsty, blaming age, blaming poor sleep, blaming stress. They have no idea that the real culprit was working against them in the dark, hour after hour, while they did nothing wrong. Here's what nobody in a 15-minute appointment is going to tell you. After the age of 60, your body's ability to regulate blood sugar during sleep changes dramatically. The liver, which is supposed to release glucose in measured amounts overnight, becomes louder, more aggressive, and far less obedient to the signals it received without trouble in your 40s. This is not a minor inconvenience. In medicine, the phenomenon is called the dawn effect, and a closely related pattern is called nocturnal hyperglycemia. Together, they explain why a person who eats reasonably during the day can still develop prediabetes, type 2 diabetes, and the cascade of complications that follow. And here is the part that should make you sit up straight. The system you rely on for your health is not built to teach you how to fix this at home. It is built to medicate it after the damage is done. There is no billing code for explaining what a glass of warm cinnamon water does to overnight insulin sensitivity. There is no 15-minute office visit where a physician walks you through 5 inexpensive drinks that cost less than $2 combined, and that can reshape your overnight glucose curve. The system makes money when you stay sick, not when you get better. That is not bitterness speaking. That is 15 years of clinical practice watching the same conversation never happen. So before going further, take a moment, subscribe to Dr. Waterling right now and hit that like button. The channel is working toward 1,000 subscribers, and it is being built on one principle, which is that the people who need this information the most are the ones least likely to hear it from anywhere else. Every subscriber moves that mission forward. And while you are there, drop one number in the comments, your age, just the number. There is a reason for asking, and it is not curiosity. It directly shapes what gets covered next, because the physiology of a 58-year-old and a 72-year-old are not the same conversation, and the content needs to reflect that. Now, here is what is actually happening inside the body of an adult over 60 between the hours of roughly 10 at night and 6 in the morning. Understanding this matters, because once the mechanism is clear, the drinks that follow stop sounding like folk remedies and start sounding like exactly what they are, which is targeted biochemistry. The pancreas is a small organ, weighing roughly 80 grams, less than a typical chocolate bar. Those 80 grams carry out 2 enormous jobs. The first is producing digestive enzymes. The second is producing insulin, the hormone responsible for moving glucose out of the bloodstream and into cells where it can be used for energy. After 60, the beta cells inside the pancreas, the specific cells that produce insulin, begin to decline in number and efficiency. Research published in Diabetes Care has shown that beta cell function decreases by roughly 1 to 2% per year after midlife. That is not a catastrophe in a single year. Over a decade, it is a transformation. At the same time, the liver becomes more active overnight in releasing stored glucose, a process called hepatic gluconeogenesis. Think of it as a factory manager sending a memo to the kidneys and bloodstream that says, "The body will need fuel before morning. Send glucose now." In a younger body, the pancreas responds with a small, precise dose of insulin to keep that release in balance. In an older body, the pancreas responds late, weakly, or not at all. Glucose pools in the bloodstream. It sits there for hours. It damages the inner lining of small blood vessels, particularly in the eyes, kidneys, and nerves of the feet. This is the quiet damage of overnight hyperglycemia, and it is the reason so many people over 60 develop complications even when their daytime numbers look acceptable. Now add cortisol to this picture. Cortisol is the body's primary stress hormone, and it follows a predictable rhythm, rising sharply between 3 and 7 in the morning to prepare the body for waking. Cortisol raises blood sugar directly. In a younger person with sharp insulin response, the rise is buffered. In an older person, cortisol meets a pancreas that cannot keep up, and the result is the dawn phenomenon. Blood sugar readings of 140, 160, sometimes 180 on a glucose meter before a single bite of breakfast has been taken. Here is the part the system will not say out loud. Most of what determines overnight blood sugar is not what the doctor prescribes. It is what enters the body in the final 90 minutes before sleep. The composition of that final intake influences insulin sensitivity, liver glucose release, and cortisol response for the entire night. And this is exactly where 5 specific drinks become extraordinary tools. Now, before going through them, a necessary word, because honesty matters more than enthusiasm. If you are currently taking insulin, sulfonylureas, or any other glucose-lowering medication, the drinks discussed here can enhance their effects. That means your numbers may drop lower than expected. That is not a reason to avoid these drinks. It is a reason to monitor your readings carefully and to discuss with your prescribing physician whether dose adjustment is appropriate. Never discontinue prescribed medication based on anything in this video. These drinks work alongside medical treatment, not instead of it. And if you experience symptoms of hypoglycemia, which include shakiness, sudden sweating, confusion, or rapid heartbeat, treat that immediately with fast-acting glucose and contact your physician. With that established, here is what nobody tells you in a clinic waiting room. The first drink is cinnamon water with a small amount of apple cider vinegar. The mechanism here is not mysticism. Ceylon cinnamon contains a compound called cinnamaldehyde that has been shown in multiple peer-reviewed studies to improve insulin sensitivity and slow gastric emptying. A meta-analysis published in the Journal of the Academy of Nutrition and Dietetics found that cinnamon supplementation reduced fasting blood glucose by an average of 10 to 29 milligrams per deciliter across studies. That is not a small effect. That is the difference between a fasting reading of 125 and a fasting reading of 105. Here is the exact preparation. Take 250 milliliters, about 1 cup of warm but not boiling water. The temperature should be around 60 degrees Celsius, roughly 140 degrees Fahrenheit, warm enough to feel comfortable in the hand but not hot enough to scald. Add 1/2 teaspoon of true Ceylon cinnamon, not the cassia cinnamon that fills most grocery store containers. Cassia is cheaper but contains a compound called coumarin that can stress the liver in regular use. Ceylon is what is wanted here. Stir thoroughly for 30 seconds. Add 1 teaspoon of raw apple cider vinegar with the mother, the cloudy strands at the bottom of the bottle that indicate live enzymes. Stir again. Drink it slowly over 5 minutes, finishing approximately 45 to 60 minutes before bed. What happens next inside the body is precise. The vinegar's acetic acid slows the conversion of starches into glucose during overnight digestion. The cinnamon improves the responsiveness of insulin receptors on cell surfaces. Together, they reduce the overnight glucose release from the liver by a measurable margin. Most people who use this preparation consistently see fasting glucose drop by 10 to 20 points within 2 to 3 weeks. The second drink is fenugreek seed water. Fenugreek is one of the most studied botanicals in diabetes research, and most people in the United States have never heard of it. The seeds contain a soluble fiber called galactomannan that forms a gel in the digestive tract, slowing the absorption of carbohydrates and improving insulin response. Research published in the Journal of Diabetes and Metabolic Disorders showed that fenugreek consumption significantly reduced fasting blood glucose and hemoglobin A1C in adults with type 2 diabetes. Here is the exact preparation. In the morning, take 1 teaspoon, approximately 5 grams, of whole fenugreek seeds. Place them in a glass and cover with 250 milliliters of room temperature water. Let them sit uncovered for the entire day, roughly 8 to 10 hours. By evening, the water will have taken on a slightly yellow color and a faintly bitter aroma. That is correct. That is the galactomannan and the active compounds dissolving into the water. About 1 hour before bed, strain out the seeds and drink the water slowly. The seeds themselves can be chewed if tolerated, but the water alone delivers most of the benefit. The taste is honestly unpleasant the first few times. A small slice of lemon can be added to make it tolerable. Within 10 days, most people stop noticing the bitterness, and many begin to associate it with the calm feeling that follows. That calm is not imagination. Fenugreek has mild effects on the parasympathetic nervous system, which is the branch responsible for the rest and digest state. It helps the body settle into sleep while it is simultaneously regulating overnight glucose. Now, the most important thing to hear about the third drink. This one is the simplest and arguably the most powerful for adults over 60 who struggle specifically with the dawn phenomenon, those high morning readings that arrive before any food has been eaten. The third drink is chamomile and turmeric tea. Chamomile has been used for thousands of years for sleep, but what most people do not know is that research published in the Journal of Endocrinological Investigation demonstrated that chamomile tea consumed with meals significantly reduced blood glucose, insulin levels, and insulin resistance in adults with type 2 diabetes. Turmeric, specifically the curcumin within it, has been shown to reduce inflammation in pancreatic tissue and improve insulin sensitivity through multiple cellular pathways. Here is the exact preparation. Heat 300 milliliters of water until just below boiling. Add 1 chamomile tea bag or 1 teaspoon of dried chamomile flowers if loose tea is preferred. Add 1/4 teaspoon of ground turmeric. This is critical. Add 2 or 3 grinds of black pepper. The piperine in black pepper increases the bioavailability of curcumin by approximately 2,000%, according to research in the journal Planta Medica. Without black pepper, most of the turmeric passes through the body unused. Steep covered for 7 minutes. Strain. Add 1 teaspoon of raw honey only if blood sugar is well controlled. If fasting glucose runs above 130, skip the honey entirely. Drink slowly over 10 minutes, finishing 30 minutes before lying down. The combined effect is remarkable. The chamomile reduces cortisol, which lowers the morning surge that drives the dawn phenomenon. The turmeric reduces low-grade inflammation in the pancreas, allowing beta cells to function more efficiently. The result, observed consistently over 15 years of clinical practice, is morning readings that drop by 15 to 30 points within 3 to 4 weeks of consistent use. Here's where it gets critical, because there is a story that illustrates exactly how these drinks change overnight glucose patterns in real life. A patient named Margaret, 67 years old, came in 18 months ago with a fasting blood glucose of 142, a hemoglobin, A1C, of 7.4, and the kind of exhausted look that comes from waking 3 times a night and feeling worse than when she went to bed. She had been told by her previous physician that her numbers were creeping up because of age, and that medication would soon be necessary. She had tried cutting carbohydrates. She had tried walking after dinner. She had tried 2 different supplements advertised online for blood sugar support. Her fasting numbers had barely moved. What was discovered after careful history was that Margaret was eating reasonably during the day, but consuming a glass of fruit juice and a small handful of crackers about an hour before bed, a habit she had developed thinking it would help her sleep through the night. That single 90-minute window before sleep was driving her overnight glucose into a sustained high. The protocol given to her had 3 components. Replace the evening fruit juice and crackers with the cinnamon and apple cider vinegar drink. Begin fenugreek water preparation in the morning, drinking it 1 hour before bed. Add chamomile and turmeric tea 30 minutes before lying down on 3 nights per week. Within 10 days, Margaret reported sleeping through the night for the first time in 2 years. By week 4, her fasting glucose averaged 118. At her 3-month follow-up, her A1C had dropped to 6.4. No new medications, no surgery, no expensive supplements, approximately $3 per week in total ingredients. Her morning fatigue was gone. Her thirst was gone. The brain fog she had blamed on age had lifted. None of this was magic. It was overnight biochemistry, corrected. Now the 4th drink, which serves a different purpose. The 4th drink is warm magnesium water. Magnesium is one of the most overlooked minerals in adults over 60. Research published in the journal Nutrients has shown that magnesium deficiency is present in approximately 48% of adults in the United States, and the prevalence rises sharply after 60. Magnesium is required for over 300 enzymatic reactions in the body, including those that regulate insulin signaling. Without adequate magnesium, insulin receptors become less responsive, and overnight glucose regulation suffers. Here is the exact preparation. Take 250 milliliters of warm water, again around 60 degrees Celsius. Add 200 to 300 milligrams of magnesium glycinate powder. Magnesium glycinate is specifically the form that crosses into tissues most efficiently and does not cause the digestive looseness that magnesium citrate can produce. The glycine portion of the compound also has its own calming effect on the nervous system. Stir thoroughly. The powder dissolves cleanly in warm water. Drink slowly approximately 90 minutes before bed. What happens next is twofold. The magnesium begins improving insulin receptor sensitivity within hours. The glycine begins calming the central nervous system, which reduces the cortisol response that drives early morning glucose spikes. Many people notice deeper sleep within the first 3 nights. Improvements in fasting glucose typically appear within 2 to 3 weeks. A note on scope here. This intervention is appropriate for adults with normal kidney function. If chronic kidney disease has been diagnosed, magnesium supplementation requires medical supervision because impaired kidneys cannot clear excess magnesium efficiently. If kidney function is uncertain, ask a physician to check a basic metabolic panel before beginning consistent magnesium use. The fifth and final drink is bitter melon and ginger infusion. Bitter melon, also called Momordica carrantia, has been used in traditional medicine across Asia and the Caribbean for centuries for blood sugar regulation. Modern research, including studies published in the Journal of Ethnopharmacology, has identified at least 3 active compounds in bitter melon that act on glucose metabolism in ways structurally similar to insulin itself. Ginger reduces inflammation and improves gastric emptying coordination, which smooths overnight glucose curves. Here is the exact preparation. Find dried bitter melon slices, available in most natural food stores or online for approximately $5 for a month's supply. Take 3 to 4 dried slices, roughly 5 grams. Add 1 inch of fresh ginger root, peeled and sliced thin. Place both in 400 milliliters of water in a small pot. Bring to a gentle simmer and maintain that simmer for 10 minutes. The water will turn pale green and develop a noticeably bitter aroma. Strain into a cup. The taste is genuinely challenging. A small slice of lemon and a pinch of cinnamon can be added to make it more drinkable. Sip slowly over 15 minutes, finishing approximately 60 minutes before bed. This drink is not for daily use. 3 to 4 times per week is sufficient and likely optimal. Bitter melon is potent enough that daily use in adults already taking glucose-lowering medication can drive blood sugar too low. This is the drink that requires the most caution and the most communication with a prescribing physician. But for adults whose fasting glucose runs persistently above 120 despite the first 4 drinks, bitter melon often produces the final shift downward. Now, here is the practical implementation framework, because knowing 5 drinks does nothing if there is no schedule for using them. Here is the complete weekly protocol, organized for an adult over 60 with elevated fasting glucose but no severe disease. On Monday, Wednesday, and Friday evenings, the protocol uses the cinnamon and apple cider vinegar drink approximately 60 minutes before bed, followed by the chamomile and turmeric tea 30 minutes before lying down. On Tuesday, Thursday, and Saturday evenings, the protocol shifts to fenugreek water 60 minutes before bed, followed by warm magnesium water 90 minutes before bed. On Sunday evening, or on whichever single night per week makes sense for the schedule, the bitter melon and ginger infusion is used 60 minutes before bed, with no other drinks that night. For the first 2 weeks, blood glucose should be measured first thing in the morning before any food, water, or movement. Write the number down. By the end of week 2, a trend should be visible. By the end of week 4, the trend should be clear. By the end of week 8 to 12, fasting glucose should be measurably lower, often by 15 to 30 points, and hemoglobin A1C, if measured by a physician, should show meaningful improvement at the 3-month mark. A few things must be said clearly. The drinks discussed today work best in combination with reasonable eating during the day. No drink can fully compensate for a daily diet built on refined carbohydrates, sugary beverages, and ultra-processed foods. The drinks are an evening tool, not a license to eat carelessly during the day. They are most effective when the final solid meal ends 3 hours before bed, when daily steps reach at least 4,000 to 6,000, and when overall sleep duration falls between 7 and 8 hours. Know also when not to manage this at home. If fasting blood glucose readings consistently exceed 180 milligrams per deciliter, that requires immediate medical evaluation, not a video. If symptoms include excessive thirst that does not resolve, unintentional weight loss, blurred vision that comes and goes, or a fruity smell on the breath, those require urgent medical attention. Diabetic ketoacidosis is a medical emergency, and no bedtime drink replaces an emergency department visit. Now here is the broader truth that ties all of this together. There is no revenue stream in teaching a 67-year-old how to lower fasting blood sugar with $3 of grocery store ingredients. There is enormous revenue in prescribing the medication she will need if her numbers continue climbing untreated. This is not a conspiracy. It is a structure, and it is the structure that explains why this conversation almost never happens in a 15-minute appointment. The healthcare system was built to treat illness, not to prevent it through patient education. Knowing this is not a reason for despair. It is a reason for self-reliance grounded in real physiology. The body after 60 is not broken. The pancreas is not the enemy. Overnight glucose is a signal, and signals can be answered. The drinks discussed here are not folk remedies. They are targeted interventions backed by published research and refined through 15 years of watching real patients lower their numbers without escalating their medications. That is what is possible when the final 90 minutes before sleep are used deliberately. If any current prescription medications are part of the daily routine, particularly insulin, sulfonylureas, metformin, or blood pressure medications, share these protocols with the prescribing physician before beginning. The drinks can enhance medication effects, which sometimes requires dose adjustment. That is a conversation worth having, and a physician who refuses to engage with patient-led nutritional changes is a physician worth questioning. This information was not shared casually. It was shared because there is real frustration with watching adults over 60 develop diabetes, complications, and dependency on medications that could have been delayed or avoided with knowledge they were never given. If this video helped, send it to someone who needs to hear it. A parent, a friend, a spouse, someone who has been quietly worried about their morning numbers and has not known where to begin. A real chance to change a trajectory may have just been handed to them. And one more time, drop your age in the comments. Just the number. It shapes what gets covered next, and it builds the community of viewers who are choosing to take their health back through knowledge rather than waiting for the system to do it for them. Subscribe if the channel has earned it, like the video if it was useful, and come back next week because there is more to share and the people who need it the most are the ones the system reaches the least. Take care of the body. It is doing more than is realized, even at 60, even at 70, even at 80. Give it the right signal in the final 90 minutes before sleep, and it will surprise everyone, starting with the person looking back in the mirror tomorrow morning.